Hi, I'm Dr. David Smith. I'm here at Bayard Animal Hospital, and today we're going to show you everything that's involved in having your pet's teeth cleaned. We're going to start from the exam, work through the laboratory, and actually go through the process of the cleaning. Alright, let's see what we have. We have a dog whose teeth are not terrible. We can see some tartar back here in the back of his mouth. These are the molars. Take a look at the other side. Again, we have some tartar back in this area. So we would call this a stage 1 or stage 2 tartar, which is where we would like to be when we clean the teeth. We would not like to be at stage 3 or stage 4, meaning we've got periodontal disease, we've got pocketing, we've got possible loose teeth. We would like to clean this dog's teeth now so that we can end up preserving those teeth. In addition to that, which is incredibly important, this is not just for oral health, this is for general health. That tartar that we saw can cause or can hold bacteria which can cause damage to the heart valves. And when that happens, you have permanent damage and murmurs, and many dogs have these as they get older. So cleaning a dog's teeth not only preserves their teeth, but it may actually preserve their well-being and health. And we're here now with Leela, our senior tech, who is going to show us that we're going to take some blood from this dog. And how would we normally do that?
I usually use the jugular and just pull it straight from the jugular.
Okay, and you have two tubes you have in your hand. And what are they for?
One is for serum and one is for plasma. For the CBC is for the plasma so it doesn't clot, and then the serum.
And then we're going to, then that lab work is sent into the big lab.
To IDEX.
To IDEX, and then we get a workup to show what is going on with this dog's body. What types of things do they kind of come back with?
They come back, well, they test the kidneys, make sure the kidney values are normal, test the liver, make sure that's normal. When they run the CBC, they make sure that there's proper amount of platelets and that they're hematocrit, they're not anemic.
And over here on the table, we'll show you the result of the test. And again, we have lots of things on here. This all shows liver, kidneys, electrolytes. It goes on to show red cell, white cell count, thyroid, and in the back here we have urine sample as well. So we know pretty much everything we can find out about this dog from a blood. Okay, now we're about to do an EKG. What have you done here, Leela? What's involved?
We hook up the electrodes and we use alcohol as a conductor.
Right.
And it gives us a, well, with this it just gives us a lead 2, which is just to check the sinus rhythm and make sure everything's normal.
And so there's our EKG, and we can tell that we're seeing all the right waves. I've already checked this dog's heart and we know that it sounds fine, and so we just want to make sure the electrical impulses that run the heart are doing the right things. The reason for that is that when we give anesthesia, we actually will cause arrhythmias in certain dogs. In other words, the rhythm will change. And so we want to make sure going in that we don't have any problems, so that when we give the anesthetic, we actually won't have any problems under the anesthesia. Okay, Leela's going to put the catheter in now. This is an over-the-needle catheter, which will go into the vein in the foreleg. And once we get it in, then it's a matter of making sure it stays in, and then we'll move on from there. And now we're about ready to anesthetize our patient for the dental cleaning. So Leela is going to use a drug called propofol. And it is a short-acting anesthetic, and that's that white stuff. And so she will slowly inject that into the vein, and that's the catheter that she put in earlier. And this will then sedate the dog. Now what we want to do is we want to get him lightly sedated so that we can put a tube in. It's called an endotracheal tube. And then the dog will be able to breathe anesthesia through a machine, which we'll show you in just a minute. Now we have the endotracheal tube, which is lubricated, and we will insert that in his trachea. Okay, now we're in the trachea, so he is breathing through that plastic tube. You can hear the air going in and out. And now we're going to connect him to an anesthesia machine, which is going to give him both oxygen and an anesthetic called isoflurane, which is a gas anesthesia. Alright, we've blown up the cuff to make sure that it's nicely sealed, and he will just be breathing the gas. We don't want him to breathe anything in the room. Next, we're going to hook up the IV catheter to some fluids. We need to have an open vein just on the off chance we have a problem during the procedure, and we'll have fluids running in just to keep that vein open, and that's just a balanced salt solution called lactated Ringer solution. Alright, now we're going to take the full set of x-rays, and we're going to take that probe and put it in the mouth, and that's going to actually be our radiographic plate. And Leela's lining up the tube. You probably all have had x-rays at the dentist's office, and this is exactly the same idea. And then we take the picture. Now this is a digital x-ray, so therefore it will instantly appear on our screen. Okay, so now we have our full set of x-rays, and we now can see, again, the front of the mouth. We can find the molars back here. What we're looking for would be bone loss. We want to make sure that there's plenty of bone around each tooth. Pocketing, obviously we want to make sure that there's no deep pockets that can cause tooth to loosen. We look for broken roots. Every once in a while, one of these roots we'll find is actually chipped or broken, and you have to take that tooth out. The other thing you're looking for also is hidden, impacted teeth. Teeth that never erupted. Now in this dog, all the teeth are here. Everything looks like it's normal, and we have a full set of x-rays. That way we can compare them when we were to do this the next time and see if there's any changes in the mouth. Very, very similar to what's normally done at your own dentist's office. And of course the next thing we do is clean the teeth. So we can see that Leela is using the same equipment that actually I had done a few days ago at my own dentist. We have a ultrasound cleaner, and she's taking the tartar off, and we're going to go through each tooth, and as she does that, she will also be checking to see again for any pocketing, any pathology that might be seen, and that'll be pointed out to the doctor, which I will be checking these teeth as we finish to make sure that there's no other problems, and we can send this dog home with a clean bill of health. This process takes anywhere from 20 minutes to, sometimes in terrible mouths we might end up cleaning for an hour. It just depends. And then if we have to do any types of other dental procedures such as extractions, we will try to have those all done at the time of this anesthesia. We don't want to have to bring this dog back and sedate them and sedate them and sedate them. Okay, now we're finishing up on the dental cleaning, and as usual with all dentals, we need to polish those teeth. So Leela is polishing all the teeth so that we don't have any grooves or any areas where particles can adhere and then start forming new tartar. So we'll finish up that. Okay, now we have to look at each tooth, and I'm doing the same thing that your periodontist would do, checking depths of the pockets, and these are all very minimal depths. We can see that the teeth look to be in really good shape now. There's not any tartar left, and we're just probing each area around the tooth to be sure that there's no deep pockets, which we can correct. And of course, we're looking at both sides of the mouth and also both sides of the teeth. So we have to come back in here and we check all these teeth back in here, make sure that there's no pocketing, and all these teeth look to be in excellent, excellent condition. And of course then we'll check the other side, and once we have determined everything is in good shape, it's time for this young man to get up and hopefully go home in a very short period of time. And that basically is how a teeth cleaning is done in veterinary medicine.